Hello viewers and welcome to MedGate Today TV. Today we are in Bangalore and we are experiencing an event named Sterilize and Rise, which is an initiative of ASP. And we, MedGate Today, is proud to be the media partner and experiencing it, witnessing it with our own experience. Today we have Dr. Salgo. He is the Vice President and Chief Medical and Scientific Officer Global at ASP. Hello sir, and it is pleasure to having you and have a great conversation in the future.
It's great to be here. I'm looking forward to our conversation.
Sir, you presented one topic over how the future of prevention and risk and margin of safety in real world setting. So you have displayed a lot of examples, a lot of facts. I would like to request you to please give our audience what kind of topics did you cover and what pointers you want the world to know.
Yeah, so I would say that my overall message is elevating the standard of care through scientific evidence. So what does that mean? I think first it's very important for our viewers to appreciate that we don't live in a perfect world where accidents don't happen, where mishaps don't happen. There can be actually mishaps during processing, instrument processing, and it's important to make sure that we have systems which can compensate for that. So what I talked about was the use of technology to elevate sterilizing standard of care with a margin of safety. Done through technology with a few parts. Number one, for patient safety, actually having a very high concentration of sterilizing agent, vaporized hydrogen peroxide or VH2O2, inside a plasma chamber. That plasma allows the chamber to have a very high hydrogen peroxide concentration, and the literature shows that that has a higher margin of safety under simulated adverse use conditions like hard water and dried protein. So number one, higher sterilizing power, great. Number two, not only elevating the standard of care for patients, but elevating the standard of care for staff as well. We have staff that work every day. They work tirelessly in these environments. We want to make sure that they're safe from both acute and chronic sterilizing agents, vapors, gases, and so forth. And that's the second key benefit of in-chamber plasma technology. When you're done with the hydrogen peroxide, you can use the plasma in the chamber to get rid of the hydrogen peroxide virtually. And then when you open the door, you have a much safer environment of just water and oxygen, which is done. So I like to say we want to oxidize germs, not people.
So you are talking about that innovation is meeting with the technology and catering the real world problem. So if you see the future of sterilization, how do you see that hospitals should cope up with the innovation and the technology?
Yeah, so we've been talking a lot about that in the conference today, both in terms of endoscopic procedures and robotic procedures. We're developing all these specialized cameras, graspers, forceps, cauterizing devices, and I see as those progress and they have more complex parts to them, the famous Spalding classification of critical, semi-critical, and so forth needs to be updated because these instruments can actually harbor some of these agents. And so I would say elevating the standard of care now for minimally invasive surgery is just as important since the future is exploding with these procedures. We're hearing hospital leaders today talk about how all of their hospitals are incorporating these. And so I would say that we want to make sure that infection prevention keeps at the pace of surgical innovation as well.
You had two words which were there in the topic, risk of margin. So how do you measure this?
So as I like to say, the answer depends on the question. And so if the question is how many bacteria do we destroy, we can measure that on a culture plate. And that's one way to do it in the lab. The other way to do it is we can measure contamination rates by doing infection prevention, or I should say cultures of surgical equipment and endoscopes to see what grows. Third, of course, is the infection rate. The important thing to realize about infection rate is sometimes patients harbor it for months or even longer. Sometimes the physicians don't diagnose it and it's underreported. So the tough thing is if you think that you can find problems only by looking at infection, unfortunately it's underreported. Therefore, we have to depend on things like contamination and lab studies to tell us what's probably going on.
Thank you so much, Dr. Ivan, for giving us such kind of brilliant insights on how we can cater the real world problem with the innovation and technology. And yes, ASP has a lot to do with the innovation and many more things are coming, I hope it.
Delighted to be here. Thank you again for the great questions.
Thank you so much.